production.
Yeah.
Okay, there. So they'll like that much better.
Oh.
So to get to today's subject,
All right.
vaccinateca.com. I'm sorry, it's not a government
It's
thing.
not government. Yeah, this
Totally
is
private.
crowdsourced, which is
Crowdsourced.
pretty neat.
Volunteers.
Yeah. Which reminds me of, I sent you that of what they're doing in Taiwan, I think it was.
It's just like that.
Yeah, so over in Taiwan, they use this crowdsourcing to help out with things like this through apps that they make. But yeah, it's essentially using the best in your community who are very good at making apps, and they crowdsource that information. We're doing it here,
and
this is a result of that.
Yeah,
now, it's only for California.
Yep. Well, they have them in other states. I just
don't
know the name.
Oh, okay. Well, I guess you probably check that out. I bet your doctor knows. Ask your doctor. Vaccinateca.com. And it's pretty neat. You just put in your zip code, and it comes up with all of the areas around you that are vaccinating, and it tells you what what ages and qualifications you need to be qualified for them to get their vaccine. So for here, we put it in, and Sutter comes up. Sutter is vaccinating down to age 75, and it says that. For those who are over 65, Safeway is. Local Safeway did not come up. I guess they're probably just booked out. That was my assumption.
That's because somebody checked it this morning and saw they didn't have doses.
But Safeway in
was it Rockland or Lincoln?
Rockland or Roseville, which is like about 15 minutes away, came up. So it's pretty neat. But I guess you were talking to the people about it, so you have a little more insight into how it's actually working. But they're actually calling people, I guess.
So. I didn't speak. I just got that one email with them when I invited them to be on the show. But I did hear an interview on NPR this morning.
Oh, excellent.
So
that's how
Capital Radio, Public Radio.
Yeah. So if you are in California, check it out.
VaccinateCA.com.
And you are over 65 because that's what it's approved down to.
Yeah.
Check it out.
Yeah, and other states. I'm sorry we don't have your links. I believe Michigan has one, but I tried vaccinatemi.com and that wasn't it. So I don't know what it is, if it is out there.
Vaccinate me?
But this is so great because I've been taking it upon myself to every day update our website.
They're essentially doing that.
I was doing what they were doing, kind of.
Yeah.
So now I just put their link at the top of the Auburn Medical Group /COVID-19, and then they're doing the work for me. Plus, they have more information than we did. It's all in one place.
Right. It's pretty neat.
And you know that somebody is actually called to check on it that day. To see if there are appointments or vaccine available.
Yes. Mm-hmm. So, have you guys gotten your vaccine? I guess that's a big question. Or are you scheduled? We pretty much just know what's going on around here. And in broader, we hear things of different states in California. Did you say different states in California? I did say that. It's different states in the United States.
Oh, okay.
I'm trying to think.
During one of our shows recently, a somewhat regular person commenting, who's also a patient, said that they were going to get theirs by now. So we'll have to hear from them.
Excellent.
If they got it.
A couple comments.
But Deborah said she got her. I know.
Yeah,
that.
Excellent. So we do have somebody who's gotten theirs. Bianca says our government was so bad we have to go back into lockdown.
Sorry.
And schools are still closed. And I know they're pushing out the vaccine over there, but I have no idea how they're doing
it.
No insight into that. So Bianca asks, are you being charged for the vaccine? I don't believe that is. I think that's actually part of
in the United States, it's
free for everyone.
Gets it. The government's buying it for everybody.
Right.
Now, depending on where you get it, you may pay for the administration. Like if people got it from us, we'd charge their insurance for the administration of it.
And that's just so we can pay our nurses to go out there and do it.
But the county didn't ask for my insurance card. I said something. They said, no, we're just giving this out.
Yeah. And I think that is was part of the whatever that act was that was passed early
CARES
March.
Act?
Yeah, the CARES Act.
Okay.
Could have been part of that. But one of the big things is we don't want that to be a hurdle to people not getting the vaccine. We don't want finances to get in the way of getting as many people vaccinated as possible.
As many as we can. That's kind of the goal of us
and I would
in
imagine
public health.
Canada and Great Britain, where it's more of a socialist.
Oh yeah, I'm sure that they just walk in and get
anything going on, or no copay or anything as well.
I would expect.
Bianca says, I was shocked you're charged for contraception, so nothing surprises me in America.
Interesting. Now, I think that varies according to state, possibly.
Probably.
And possibly according to different presidential administrations. I do know that that's kind of changed.
It could. Yeah. I think.
And I actually don't know what the current is, both federal and state.
Yeah.
If
Biden
it's required
did
or not.
a whole heap of pen sweeps, writing things, pausing things, freezing things that Trump did. So.
Yeah.
Who knows where we are with all that stuff.
Kind of all in one fell swoop.
At this point, just kind of
undoing the whole thing.
Let's undo everything for the past.
Even the good stuff. Yeah. So,
yep. Young says we take the NHS so much for granted.
Yeah, so it's probably easy to do when you just have, you don't even have to pull out the card. You just
right.
Well, I guess you have to pull out your NHS card. I don't know.
How does that work? Is it like your identification card, or
I think it's the microbots. They inject them for identification.
They show up and it scans your arm.
They scan them as they walk through the scanner, and that's probably what it is. You can't buy or sell unless you got it.
The QR code on your forehead.
QR code. Have you seen QR codes kill kittens?
No, I haven't seen that. This sounds intriguing.
It's a book. I'll have to give it to you.
It's a book. Okay. Yeah. It sounded like a YouTube video.
No, it's a book.
Okay.
With pictures, funny pictures.
Okay, I'll check that.
I wish I could come up with the name of the author. I feel I'm blanking. His first name's Scott, but I can't come up with. He autographed it for me.
Wow.
Yeah. QR codes kill kittens. If you need a good laugh and you're a little familiar with the tech world, especially of about 5 years ago when that book was written.
Yeah.
It's a little dated now, but it was. He did a talk on it. It was really fun. I rolled off my chair laughing. A little embarrassing in front of my niece. She was there too, but I was really laughing. And Jeff Dickerson, he was sitting by us too.
Oh, excellent. Yeah. Well,
so if you have questions,
we
would gladly answer them about either the vaccine or getting the vaccine, finding the vaccine, or how we handle this situation that happened in Placer County over the weekend.
Right. Or any death in close proximity to getting the vaccine.
Yeah.
They're all being investigated.
So we could restate what we did on the video, and that is for 18 million people to have gotten the vaccine already in a month's time, you'd expect there'd be about 1,800 deaths for 18 million people in the United States
getting COVID
over a month's time. Usually there's about 18.
You're talking about just regular.
Usually there's about 1,800 deaths.
From COVID,
Yeah, so just because somebody dies does not mean it was the vaccine.
Around that time.
But it should be investigated.
And currently our numbers are such that 1 in 1,000 people in the United States
has already died from it.
Has died from this disease. So
all comers, the ones who had it, the ones who have it, 1 in 1,000 has died.
Everyone, which is just devastating to think that many people have been
0.1%.
And then that's not talking about the people who are, have some debilitation as a result of it, which is a small fraction, but.
Well, there's a lot of people that have the ongoing symptoms for a long time. That's
I got a message today in my inbox about somebody having a chronic cough from it. Other people getting chronic fatigue where they feel like they can't get out of bed. These long haulers, as they've been called.
Yeah, it's a big deal.
Yeah, that it's life changing for a lot of people.
Yeah. So it is more than those who die. That's the easy statistic to look at. But I would dread ending up like Father Josh, for example, where you just can't work for some days of the week. Still, weeks later.
Yeah, when I had my COVID, I was fortunate to come out of it pretty much unchanged. But I did have a cough for like 3-4 weeks afterwards. It got better, but it had this cough that just kind of hung on with this mucus production. It's I would much rather get the vaccine. I guess it comes back to that. Get your vaccine rather than get COVID.
And you getting the vaccine brings up that question that many people ask, well, if somebody had COVID, why would they get the vaccine? The reason is because the immunity from the vaccine is more of a sure thing than from having had COVID. It's more likely to last longer and provide protection, and provide protection against some of these variant strains that you want as much protection as you can get when they hit you, because there's people in South Africa getting COVID-19 after having had it.
Right.
With this new strain.
Actually, that's one of the things that Robert Antonio brought up.
Oh, yeah.
He brought up the Oxford strain, but maybe we can talk a little bit about those other strains.
Okay. I don't know one by the name of Oxford. That might be
That's
B1117 or...
The one that's in England is probably the one that he's referring to.
And that one...
Which is now in California.
There's some question on whether maybe it might have a little more severe effect than...
Well, definitely more contagious.
But it's kind of a question whether it does. So to me, that means not a big deal. But this one in South Africa is a very definitely is both a little more severe and people are getting it after they've already had COVID-19.
Right.
And they don't...
Reinfections.
Moderna says that their vaccine is not as effective against it as it is against the regular strain.
At least partially effective from what I...
But they say partially effective, given how effective it is in the first place, it's still really good. But that they might have like a third dose or maybe even integrate a new protein into it. Mm-hmm. Yeah, which hopefully wouldn't have to go through all the testing they had to go through with the first one because they've done the first one. Let's just do what's necessary to know that that new protein's not going to cause any problems, which chances are it won't, but but it should be checked.
I just want to see if there's anything else while we're...
Yeah, absolutely.
Because
we are here for you.
Just filling us in on how great NHS is. Thanks for rubbing that in our face.
Yes.
We appreciate that, Bianca.
Yes, I would imagine it is nice.
But her parents had hers in 85 and 73.
Okay.
So I don't even know how the NHS is going about doing that. I don't know what ages are.
I haven't heard or read anything on. I've been paying so much attention to local. I mean, really local. Like,
has your taste and smell come back? Yes, thank you for asking. Actually, that was only gone for about a week and a half. So I am fortunate that came back completely. I am able to enjoy morning coffee again.
There are people who are...
But there are those who have that go on for months.
Thankfully, it's a very small percentage.
Yeah. But that was probably the most distressing because I didn't get any respiratory. I mean, if I had respiratory effects, that would be very distressing. Right. But like going through life without tasting or smelling anything it's miserable. Anyways, got a post on that. Go check it out at drgreenknight.com. You can see what it's like. Not sure about the frontline workers. Our daughter works in the VA, and she doesn't know when they're getting theirs. I thought the VA
was getting it to everybody.
To their patients. I have patients in the VA who were getting theirs before I got mine.
Yeah. We're getting reports from patients who are married to people in the VA, and they're upset because the VA patients got it. Why can't I get it?
Yeah.
Somehow the VA got a lot of vaccine. I don't know if it's through the DoD or not.
Sure.
They got their own separate little carved out chunk of vaccine supply and give it to them.
I would imagine that most doctors have and nurses have gotten theirs,
or at least had the opportunity.
Yeah. So that's why they're moving on to those 75 and older. That's technically in that 1B group, but I think at this point those groups have pretty much been thrown out the window, and they're just like. Everybody's 75 and older. Everyone's 65 and older.
It's like the gates at the Capitol. Just let the people. Let's let the people come on in. Just everybody come on in.
Yeah.
You can all sit
in Pelosi's
chair. You get a podium. And we're all waiting for our podiums now, since they said we could all have one. Yep.
Yeah. Where's mine?
Yeah. Anyways. But I know there's some people out there that's very frustrating for. Do be patient. Easy for me to say. But do look daily at whatever your area has for tracking where vaccines are available and keep checking in every day and sign up when you finally get an opening.
Right. Yeah.
Yep. Even if it's in March.
Right.
Take it.
Yep. Again, very safe from the data that we have gathered thus far. Yeah. And it is a lot of data. 18 million people is a lot of people that we have.
18 million people. 18 million people, 18 million first doses so far.
First doses.
That was as of this weekend. There's more now because they've been giving them out today.
Yep.
So, incredible safety record. Even with the occasional report or, hey, let's investigate this person who died, or the anaphylactic episodes there were some people who were hospitalized.
Yeah.
So
2.5 in a million for the Moderna, 11 in a million for the Pfizer. I mean, we're talking
a million. And that was for something that's reversible.
Yeah. No one's died from those. Everyone's,
Yeah.
maybe a hospital stay overnight, but they've
Yeah.
all come out of that just fine. And
Yeah.
that's been pretty much the severest reaction.
So
Sore arm, yeah.
So
Go get a tetanus shot. You'll have an even more
yeah,
painful arm.
they talked about how there were some deaths in Norway and in Germany. 20 or 30 in Norway and 7 in Germany, and they were investigating them, and it was these different situations for the people. And so the question was coming up, well, if people are that frail, should they be getting the shot?
Right.
Well, still, even that many now we have to take into the whole world how many doses have been given. It's over 50 million.
Which many of those were older individuals.
Yeah.
We're talking 85 and older.
Yeah.
And probably pretty frail.
So still, I would say, even those people, I would say, get the vaccine rather than not.
Agreed.
Given the whole numbers.
Right. I would say that your
overall
risk of dying from COVID or having a severe course as a result of COVID is much higher than your risk of having an issue with the vaccine easily, even if you're old and frail.
1 in 100, 1 in a million.
Yeah. So somebody, who was it, Robert Antonio, I've heard that the CDC may be considering extending the allowable period between the first and second vaccinations.
I wouldn't be surprised. It's not an allowable limit. I never read that it was, you had to do it within a certain period of time. It's always, you want there to be a minimum between the shots to get the best effect for it. But then after that minimum, it's not a big deal to go out past that.
Right. There are some vaccines. We give a lot of little baby vaccines here, and they have windows. This is similar to like the shingles vaccine. So the shingles vaccine, you get a shot, and then your second shot needs to come between 2 and 6 months. So they may put something like that, put a window in there where they say you got to get it in this area. But right now, they're just making a, they say, okay, 3 months for Pfizer, 3 months, 3 weeks for Pfizer, 4 weeks for Moderna at this point. So right now, most people are getting scheduled for that second one when they get their first one. We're still waiting. A week from tomorrow, we get our second shot, so we got to get that scheduled.
That's right. Wait for that email
through the county, and I'm sure that'll be coming. So
yeah. Well, that's a lot of questions.
Did anyone in your family catch COVID? Yeah, we all did.
Not me. You.
Not him. No. And I I don't think any of us have actually caught it from work. I don't think any of our employees had actually caught it from work. It was all. We're pretty good here. We're medical professionals. We know how to avoid infection.
Us sitting less than 6 feet from each other for this long is the worst violation that we have here.
Yeah.
Let me get over a little bit.
Get at it.
No. All right.
But yeah, so we are adhering to all the rules. Yeah. And yes, I caught mine. Everybody caught it. It was.
Yeah. You're seeing us at our worst right now.
Yeah. That's the face we put forward to.
Which is what we show on thousands of people on YouTube. We show ourselves
going out to
the worst. Yeah, that's not cool.
Oh man.
2 people who've had the vaccine, one who's already recovered from it. So I'm thinking we're talking about pretty low risk there.
Yeah.
Okay. Thank you. Anybody you want to thank specifically?
Absolutely. So over at drgreenknight.com, got a new post up today, as is every Monday. Make sure you sign up for that over there. It is about COPD today. So I bet you probably know somebody who has COPD, also known as emphysema or chronic bronchitis. Just a diagnosis spotlight where I just go over everything you need to know about COPD. So go check that out. A good read, and can pretty much get you up to spec on everything you need to know about it. So over there, I do have some patrons I'd like to thank. Teresa Roat and Boo Boo Kitty. Thank you for what you do. Appreciate it.
And I'd like to thank Boo Boo Kitty and Lindsay Antwine. Until next time.
Hey, I'm Dr. Dwayne Vaughn.
And Dr. Mark Vaughn telling you to stay in good health. Again, I forgot on the